Hello viewers, how are you? I think you all are fine. Now I inform you about mesothelioma versus lung cancer. So let's go. Mesothelioma and lung cancer. Exposure to asbestos generally causes two major types of cancer: mesothelioma and lung cancer. Both cancers affect the lungs and chest by causing pain and reducing lung function. Death rates for mesothelioma and lung cancer tend to correlate with each other. The 5 states with the most mesothelioma deaths also have the most lung cancer deaths. Each disease can take decades to develop, yet only months to spread to distant organs. And they have similar diagnostic procedures and treatment techniques. In addition, lung cancer and mesothelioma have overlapping symptoms. They both commonly cause chest pain, coughing, difficulty breathing, fatigue and weight loss. If a patient has these symptoms along with a history of asbestos exposure and/or a history of smoking, doctors should immediately suspect lung cancer or mesothelioma. But despite having a number of similarities, these cancers differ in physical characteristics and non-asbestos risk factors. Differences in development between the two cancers. While mesothelioma and lung cancer can develop after exposure to asbestos, each occurs in different areas of the body. Lung cancer develops in the lung itself, while mesothelioma usually develops in the lining of the lung. Mesothelioma can also develop in the lining of the abdomen, heart or testicles. The two cancers grow differently. Lung cancer tends to grow in individual masses with defined boundaries. Mesothelioma starts as tiny tumor nodules that scatter the mesothelial lining, and eventually grow together to form a sheath-like tumor around the organ. Mesothelioma is almost exclusively the result of asbestos exposure, while the majority of lung cancer cases are attributed to causes like tobacco use and environmental exposures to radon gas and secondhand smoke. And while smoking does not influence risk of mesothelioma, it greatly increases an individual's risk of developing lung cancer. Those with the highest risk of lung cancer are smokers with a history of asbestos exposure. By themselves, each risk factor damages lung tissue and makes it more susceptible to diseases. So when smoking and asbestos are combined, an individual's lung cancer risk increases at least 50-fold. Facts about mesothelioma. 1. 80% of mesothelioma cases are the result of asbestos exposure. 2. This cancer typically takes 20 to 50 years to develop after initial exposure to asbestos. Facts about lung cancer. 1. 80% of all lung cancer deaths are attributed to tobacco use. 2. 12% of lung cancer deaths are radon-related. 3. Lung cancer has a shorter latency period and may appear 10 to 30 years after first exposure to a carcinogen like asbestos or cigarette smoke. Diagnosing mesothelioma and lung cancer. To diagnose either type of cancer, a doctor may perform an X-ray, a bronchoscopy or a biopsy. During a bronchoscopy, the doctor inserts a tube down the throat and into the airways of the lung to detect abnormalities, such as visible tumor growth. If the doctor finds a regular growth, he or she may collect a cell sample and test it for cancer. In a biopsy, the doctor removes a small portion of suspicious tissue and tests it for cancer growth. The doctor may be able to perform this procedure using only a needle and no incision. To collect a larger sample, however, he or she may need to perform a minor biopsy surgery. Another test is performed only when doctors suspect a patient has lung cancer. In this test, called sputum cytology, the doctor collects and tests a sample of thick phlegm that the patient coughed up from the lungs. This test may reveal abnormalities like blood or cancerous cells in the phlegm. Treating these cancers. For mesothelioma and lung cancer, treatment options largely depend on how much the cancer has spread. Most treatment plans include some combination of surgery, radiation therapy and/or chemotherapy. If the cancer is localized to the lung area, surgery may be able to remove all or most of the tumor growth. But surgeries vary by specific type of cancer. Examples. 1. To treat pleural mesothelioma, a surgeon may remove the lining of the lung, the affected portion of the lung or the entire cancerous lung. 2. Typical lung cancer surgeries include removing a small portion of the lung, a lobe of the lung or the entire lung. For both types of cancer, chemotherapy and radiation therapy are also considered standard courses of treatment. If the mesothelioma or lung cancer is localized, either treatment can be used to shrink tumor growth and potentially kill all tumor cells. When used in this potentially curative way, Chemotherapy and radiation therapy are typically combined with surgery. These treatments can still be used if the cancer has spread beyond its original location. In these cases, treatments are palliative and aim to reduce symptoms. Experimental therapies are being tested through clinical trials for both cancers. Some of these innovative therapies include immunotherapy, gene therapy, photodynamic therapy, and serotherapy. Photodynamic therapy is used more routinely in the treatment of lung cancer than in mesothelioma. Prognosis: 1 year after diagnosis, survival rates for lung cancer and mesothelioma are close. 42% for lung cancer patients, 39% for mesothelioma patients. Survival rates diverge after several years, with lung cancer patients having a long-term survival advantage. A decade after diagnosis, 10% of lung cancer patients and 4% of mesothelioma patients are alive. Beyond the statistics, though, is the need for someone with an asbestos cancer to secure an accurate diagnosis. Is it asbestos-related lung cancer or is it mesothelioma? The next step would be to formulate the best individual treatment plan.
Every death that occurs from an asbestos exposure could be prevented.
Don't be fooled. There is a connection.
Everything just ties together.
I don't know what I can do.
It's hard to describe what ADAO has been in my life. I certainly can't imagine it without ADAO.
We've come a long way, and I'm really proud of ADAO.
Keep me in your heart for a while.
The reason why we don't have a ban is that a lot of people don't understand the issues and the facts surrounding that people are still being exposed. I think a lot of people don't understand that there is currently not a ban, which is part of the problem. And especially decision makers in Washington don't understand that there's not a ban. Also the fact that a number of individuals think that it's not a current and consistent problem, which is entirely wrong as well. We continue to have asbestos contamination in our products. We continue to have asbestos contamination in our homes. We continue to have asbestos contamination around sites and waste materials that are being disposed of all throughout the country. And so the fact that there's a lack of understanding is a large part of the problem that we're dealing with, as well as various interests that would prefer that asbestos issues and liability not be brought up in terms of a ban or in terms of public health actions. The organizations such as ADAO and groups and constituents and other organizations similar to ADAO are vitally important in terms of educating and making people aware of the problems. While we in the government try to put out information, get data, etc., we're not nearly as effective as organizations like ADAO in terms of building public interest and support and showing how these public health threats such as asbestos affects people's lives, how people become sick and ill, and being able to connect with the community and show the community in ways that the government doesn't effectively communicate about the real concerns and the real issues in their day-to-day lives. There's been kind of an ongoing issue in terms of getting good data to help them understand, especially data in the non-workplace. So data about outdoor exposures and product exposures. Matter of fact, many products that are in the market are still not evaluated by anybody in terms of their asbestos exposures and content. Americans continue to be misled or misbelieve that products that are there's a thing called asbestos-containing products or asbestos-containing materials, and that these are materials that have less than 1% asbestos in products. And these products don't have to say that there's asbestos in there, but yet they pose a hazard. So many Americans and many individuals have no idea that these products, while less than 1% asbestos in them, still pose a significant hazard of exposure to them and their families and to workers across this country. So It's by weight. So if you took a bag of rocks and, not even a bag of rocks, if you took a bag of feathers, excuse me, a bag of feathers, and you put in a rock, that bag, all the weight of that bag would be to that rock, essentially. 99.9% of the weight of that bag would be the rock. Whereas you could have thousands and thousands of feathers in there. So when you were to open up that bag, the feathers would constitute your exposure. The rock would be very little, but the rock is all the weight. That's the kind of thing that happens with asbestos and materials. That asbestos has very little weight. It's light and fluffy. And so these products that would say, well, it's less than 1% asbestos by weight, you could still have huge exposures. In Libby, for instance, or the Libby zonolite attic insulation, could have way less than 1% of asbestos in that material. It would not be classified as asbestos containing. However, when you disturb it, it easily exceeds all of our occupational and non-occupational regulations and poses a significant hazard to those who are exposed. I think we started down this road, and I think EPA and many other organizations are starting to kind of pick this up. And the fact is they have to demonstrate how people are truly exposed to asbestos and what those exposures are. So you'll see pictures of people out on a ball field or something to that effect, running around with suits on and actually having measuring devices or riding their bicycles, and they're demonstrating the fact that these areas are contaminated, and then when people disturb them, playing ball or soccer or mowing their lawn, that in fact they are having these exposures. We have a study recently that was done by Dr. Jim Millett, who went into homes that had vermiculite attic insulation from Libby and just did some normal activities up in there and just put in an electrical box and disturbed it and showed visually, and both in terms of measurements, the levels of asbestos that were generated and how high they were and how problematic they are. Additionally, we have not been great in associating disease with these exposures because it happens so many years later, but there are cases coming forward about individuals who did these types of activities and are beginning to show with disease as well.
But thanks for coming, and thanks for making this the most successful conference thus far.
Keep me in your heart